we don't really know what perfect is. And what we are trying to develop now is what we call transdisciplinary work. So right now we have ENTs that work isolated, and we have orthodontists that work isolated, and we're never together under the same roof. And every day I do consultations with kids that I see with problems, and they go to the ENT, and the ENT says everything's perfect, tonsils, adenoids, everything's great. And when we really look at them, we go like, no, it's not great. And I just came back from a snoring workshop that we did in Mexico, where I was able to get Dr. Engelke from Germany, Dr. Rangel, it's a triple PhD, Dr. Rangel, neurologist and ENT, lab technician, general dentist, and orthodontist. We had our patients for a full week, 7 days. We gave them sleep halter to look at their sleep for 7 nights, and they came to the office every day. We did endoscopy. We have that course all on video. If anybody's interested in watching it, go to our site, and we have the whole workshop. And we cured every single one of the people that came that had snoring issues. Why? Because we had 5 practitioners all on their same roof, seeing every patient together. Dr. Rangel did the endoscopy, put it in the nose, and we saw, how we were adapting the devices, how they were doing the uplock, how they were breathing, and even people that looked like everything was fine, no overweight, no jaw problems, but they were snoring. We were able to understand what was going on because of the lateral collapse, things that I, as an orthodontist, had no idea it existed. Mm-hmm. We had this one young kid, very athletic, perfect jaws, wide arches, and he was snoring like a logger, young guy. And when we did the endoscopy, we saw that his collapse was lateral. So we were able to work with the uplock and work with a very, very lightly calibrated CPAP. And the lightly calibrated CPAP is critical because here at Stanford, they give people their CPAP and they have their mouth open and they just wear the mask, or even when they wear the nasal cushions, they have their mouth open. So they're losing half of the pressure. So if you calibrate it properly, you teach them how to do the uplock, which is, when you put your teeth together and you swallow, you take all the air outside your mouth and your mouth stays closed by suction. If you learn to do that, then your CPAP can be calibrated very lightly. And then the CPAP becomes an asset that is very comfortable to use. So we were able to work all these things together because the ENT doesn't know what I'm doing. I don't know what they're doing. The lab technician is doing something in a different room. So we had everybody together, and we had the patient, and the 5 of us looked at the patient together. And that was amazing. I don't know if that can be replicated anywhere else, but that is the key. So again, to answer your question, what is normal? We don't know, because the absence of disease doesn't mean things are normal. The fact that this is normal, it could be normal because that's the norm, but that doesn't mean healthy. So normal doesn't mean healthy. And the fact that somebody sees that their baby and says, I had a perfect 1,000 days, but they have an issue, maybe they didn't have perfect 1,000 days. Maybe you don't really know what perfect was. Mm-hmm. And we're trying to have guidelines so that you can get as best as possible.